My name is Paige Williams, and today I'll be presenting a project on the national nursing shortage. If you haven't heard of it before, you may be wondering, what is the nursing shortage? A nursing shortage is when there are 50,000 to 150,000 unfilled RN nursing positions in the United States. It is an unsafe ethical dilemma that leads to extreme understaffing and poor quality care for patients. Nurses may have a higher patient per nurse ratio, which may lead to unsafe practices. In the last few years, the national nursing shortage has gotten far worse. This has prompted the American Nurses Association to plead the Biden administration for help. The American Nurses Association has called on them to help through the Department of Health and Human Services to declare the nursing shortage as a national staffing crisis, which will ultimately be leading to poor patient care. The causes of the national nursing shortage are multifactorial. Some of the issues that have caused the national nursing shortage is baby boomers retiring, nursing burnout, emotional fatigue, and more infamously, the COVID-19 vaccine mandate for nurses and healthcare providers. Although there is what is known as a nursing pipeline, which means many new graduate nurses are being put into the medical field, this amount of new nurses will not fill the major need for new nurses to replace the baby boomers that will be retiring. Before the COVID-19 pandemic, there were projected to be 1.2 million vacancies of registered nurses. In comparison to today's vacancies, this number has significantly increased. By 2025, the shortfall is expected to double and be worse than any nursing shortage experienced by the introduction of Medicare and Medicaid, which was in the 1960s. 1 million registered nurses are over the age of 50, and with the retirement age being 65, this means we should predict for even more nurses to be leaving the medical field for retirement within the next 10 to 15 years. Again, this study was done before the COVID-19 pandemic, which means likely there will be a lot more nurses retiring, which will increase the nursing shortage. Since the COVID-19 pandemic occurred, a lot of us have heard the term nursing burnout being frequently used. Since the pandemic started, a lot of nurses have reported feelings of anxiety, depression, and work overload. About half of nurses reported feeling burnt out and overloaded with work, and 61% of workers reported fear of exposure or transmission of COVID-19. A lot of the fears of being exposed to or transmitting COVID-19 could stem back to in the earlier days of the pandemic when protective equipment for nurses was scarce and we were having to reuse what we had. These reports of fatigue have prompted hospitals across the nation to try to find ways to combat the burnout in order to retain their nurses. Some of these measures have been to provide safe rooms for nurses to take breaks, incentives for nurses who haven't called off over a time period, and bonuses for retaining loyal staff. Telemedicine appointments have also become the new normal, when possible, for qualifying clinic visits or even specialist appointments in order to try to reduce the spread of the COVID-19 virus. This has helped to alleviate some of the nurses' concerns to an extent. As most of us have heard on the news and in social media, another factor that is worsening the nursing shortage is that in September of 2021, the Biden administration announced they would be mandating the COVID-19 vaccination for all healthcare workers that receive payment from Medicare or Medicaid. This mandate makes it virtually impossible for the decision to be left to individual hospitals to make their own decisions on whether or not they would mandate the vaccine. The revenue that most hospitals receive are from the government-funded Medicare and Medicaid. If hospitals chose on their own to not accept Medicare or Medicaid in order for their employees to choose whether or not they want the vaccine, most of these hospitals would go bankrupt and not be able to afford to stay afloat. Many nurses feel like they have been backed into a corner by this mandate and are being forced to either take the vaccine or to quit the profession that they love, hence worsening the nursing shortage. Now that we have discussed the reasons for the national nursing shortage, it's time to talk about solutions to fix it. When the American Nurses Association called on the Biden administration for help, they adopted several potential solutions to fix the crisis that will fix the negative impact on our long-term nation's health and well-being. These potential solutions are to start by addressing the current fatigue and mental well-being of nurses, developing strategies to retain the current nursing workforce, working with CMS to adopt new payment methodologies that recognize the value nurses bring to patient care, removing barriers to practice faced by nurses, addressing the persistent barriers that limit the number of qualified nursing students that can be educated each year, and building and maintaining a resilient workforce to meet our country's current and future healthcare needs. The American Nurses Association also should suggest that the administration provide incentives for recruiting new nurses and supporting and retaining nurses who have already been in practice, to remove unnecessary barriers for practicing advanced practice registered nurses, or APRNs, and to continue providing education to citizens of the nation about the importance of getting the COVID-19 vaccine. Educating and encouraging the nation to get the vaccine will reduce stress and anxiety about the vaccine and help to slow the spread in patients being hospitalized. This would in turn reduce the nursing burnout. With the current nursing shortage, there are a few different nursing codes of ethics that could potentially be being violated. These ethics are social justice and beneficence, because while nurses are obligated to protect patients from harm and care for them, when there's a staffing shortage as great as it is, it's challenging for these nurses to care for their patients and have the one-on-one care needed to accurately and precisely care for their patients. With the COVID-19 pandemic, nurses may be fatigued and are facing burnout, which causes them to be in moral distress. This makes it hard for them to do what is best for each and every patient they care for. The nurse may also potentially violate the non-maleficence principle of the Code of Ethics, because with such a staffing shortage, the patient's safety is not always optimally ensured. The nurse may also break the 5th provision of the Code of Ethics, which is when the nurse owes the same duties to self as others, including to promote health and safety, preserve wholeness of character and integrity, maintain competence, and continue personal and professional growth. However, this is not likely possible because with such burnout that we've already spoken about and emotional distress plaguing the practicing nurses, this may not be possible. The 6th provision of the code may also be broken because this provision states that the nurse, through individual and collective effort, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality health care. In this year's world of nursing, employment settings and conditions are not ensuring safe, quality health care. In my opinion, the suggestions made by the American Nursing Association are ones that I feel could help to reduce the nursing shortage. This would improve patient quality of care and patient care outcomes, as they would have more individualized one-on-one care. Nurses would not be assigned to care for so many patients at one time. I think the suggested solutions to the nursing shortage that would make the most difference would be to initiate the retainment bonuses, give nursing staff hazard pay for caring for patients with the COVID-19, and to make nursing education more attainable by removing so many obstacles that we face to get into a nursing program.